Now I would like to introduce our next speaker, Luanne Southern, who will give us an important update on the groundbreaking work of the Texas Child Mental Health Care Consortium and how it's changing the landscape of children's mental health in Texas. Ms. Southern is the Executive Director of the Texas Child Mental Health Care Consortium. She has worked in mental health for many years and has extensive knowledge about the Texas children's mental health system. Ms. Southern has served in national, state, and local positions in the private, public, and nonprofit social service sectors. She has also served as Deputy Commissioner for the Texas Department of State Health Services, has worked at the Austin State Hospital, and for the Travis County Local Mental Health Authority. Ladies and gentlemen, I welcome Luanne Southern.
Wow. Jennifer, thank you so much for your story. It's hard to follow that, honestly, but I think it really does highlight some of the things that we need to do differently in our work. And so I appreciate very much the presentation and the vulnerability. You know, I can't imagine how hard it is to stand up here in front of people from systems and talk about your experience. And I'm very impressed with the fact that she was able to do that. So I am the Executive Director of the Texas Child Mental Health Care Consortium. How many of you have heard of us? Oh, good. A lot of times, most people know us for some of the programs that we are implementing across the state of Texas. One of those people called TCHAT, which stands for the Texas Child Health Access Through Telemedicine Project. And the other one is called CPAN, which stands for the Child Psychiatry Access Network. Most people know us because of those acronyms that we like to use a lot in our work. Our consortium was created by the 86th Texas Legislature through Senate Bill 11. And when I talk about the consortium, people always kind of want to know where we fit in the continuum of care for children's mental health in our state. And so the way I think about it is every child in Texas, in order to be healthy and well, if they require assistance and support for their mental health, we need a continuum of services that ranges all the way from respite care and early intervention and prevention all the way through to inpatient psychiatric hospitals and out-of-home placements. And where I think that the consortium fits and our programs fit, especially our TCHAT program, is in that early identification phase of the continuum. And as Jennifer stated earlier, that early identification piece is so important. And so I'm going to talk a little bit about all of our programs, and I will focus most specifically on the Texas Child Health Access Through Telemedicine and our Child Psychiatry Access Network. But our consortium was developed to really improve access to mental health services for children in our state. We are comprised of a very large consortium that is made up of the Texas Academic Health Science Centers. We call them health-related institutions across our state. So there are 12 that have schools of psychiatry, and they are engaged with our work, and they are the regional hubs for the services that we provide across the state. We also have representation from state agencies, the Texas Higher Education Coordinating Board, which is the place that receives the funding through the legislature for our work, and the Health and Human Services Commission. And then we also have the Hogg Foundation for Mental Health, the Meadows Mental Health Policy Institute, and the Texas Council of Community Centers, which represents the local mental health authorities across Texas. And then you can see we also have other members. We have Baylor Scott and White, and then the University of Texas System, which is where I work. The timeline for our work, we started through the 86th Texas Legislature, which happened in 2019, and then we had this thing that occurred across the world called COVID-19. And so here we were trying to implement brand new services in our state when we were all being impacted by being at home, not being able to be out in the community and meet with schools and meet with pediatric primary health providers and meet with all of the people that are part of our work. But we were able, despite COVID, to get some things done. And so you can see by this timeline that we established agreements with those health-related institutions. We started our 1-888 number for primary care physicians to access child psychiatrists and mental health professionals. And then we started our work with our community psychiatry workforce expansion initiative. And then we started our first referrals into our Texas Child Health Access through Telemedicine project. So despite COVID, we actually have gotten quite a few things done. Our programs through the consortium, I talked about the Child Psychiatry Access Network, the Texas Child Access through Telemedicine, but we have another couple projects that are really focused on the children's mental health workforce. And I know all of you in this room who work for agencies are very aware that we have a significant workforce issue, not only in Texas, but across the United States, where recruitment and retention of staff in all of our projects and our programs is a significant need. Any of you also who have had to refer kids looking for a child and adolescent psychiatrist know that we have a significant shortage of those particular professionals as well. So these two programs, the Community Psychiatry Workforce Expansion and the Child and Adolescent Psychiatry Fellowship Program, are designed specifically to focus on improving the numbers, increasing the numbers of child and adolescent psychiatrists that are trained in our state, and hopefully we want to retain them here in Texas. We also have a research initiative that's going on that I'll talk about in a minute. So our Child Psychiatry Access Network, because there is a significant shortage of child and adolescent psychiatrists, we know that one of the primary places that children with behavioral health needs go for treatment is their primary care physician. Their pediatric primary care physician, maybe it's a nurse practitioner, maybe it's a physician's assistant, but children are being seen for their mental health needs through primary care. And so what we want to do is, if a primary care physician has an issue going on with a patient that has a behavioral health need, that's a child, and they are stumped, like let's say Johnny's been seeing me and I'm a pediatrician for maybe 5 years, but it just seems like his condition might not be as stable as it once was, and I am really struggling with trying to help figure out what might I be able to do to improve his functioning? Is there some treatment that I should know about to refer him to in the community? What about medication? Is the medication that he's on working? It just seems like things are not right. What we're able to do is provide a 1-888 number for that primary care person to call and get a consultation directly from a child psychiatrist or a mental health professional who understands and has training in children's mental health. The other thing that we do is we provide care coordination. A lot of our calls into CPAN have to do with referrals. A lot of times there's a struggle. I feel like Johnny needs something more, but I don't really know who to refer him to. And so where can I go? What kinds of resources are out there for me as a primary care person to refer that family to? And we also provide continuing professional education focused specifically on certain types of children's mental health issues and topics. So we might provide ones, for example, on attention deficit hyperactivity disorder. We might have a training on trauma and the impact of trauma on a young person. And so we are there to also provide those kinds of resources to the primary care community. In terms of our map, this shows on the left-hand side all of the health-related institutions that are involved in our work, and then their regional coverage areas of the 264 counties in the state of Texas. Our enrollment, so what we do is we reach out to primary care providers and ask them if they'd like to enroll in CPAN so that we can track the calls that we get. Right now we have about 9,400 enrolled providers across our state and about 1,755 clinics that are enrolled in our work. We think that's really a great number. People from other states are a little bit surprised by that, but hey, we're Texas, right? So not every single primary care practice is enrolled. We're hoping to get to the point where we can reach out and do more and have more engaged with us. But this is data, and I don't know if my PowerPoint, I mean, it's downloaded now, but I know I turned mine in really late, but it was because we wanted to give you updated numbers so we can give you the most up-to-date information. And right now, we've completed about 13,000 consultations to primary care practices across the state, and that covered about 12,000 young people, patients that are engaging with primary care practices across our state. And you'll see here, this is from a quote from one of our pediatric primary health providers. This is exactly the help small rural communities need to help with mental health of our children. One of the things we know about our programs is because of the way they're structured, we have been able to provide access to mental health care for people in extremely rural areas of our state that might not otherwise have access to mental health care. And I'll give you an example. A couple weeks ago, we did a site visit to Lubbock and visited our health-related institution at Texas Tech. And Texas Tech Health Science Center covers 85 counties in our state. And they showed us on a map that of those 85 counties, there were about 6 of those 85 counties where there was not a provider available for kids. So through our telemedicine, through our consultation with the 1-888 number, those counties, if there are children living in those counties who need mental health services, they can get them through our programs. The other thing is that during this past summer, there was a special session that the legislature appropriated federal funds to us to enable us to expand some of our work. So these are examples of how our federal resources are being used. We have a suicide prevention training going on for primary care practices. We started a perinatal psychiatry access network that allows OBs, obstetric physicians, as well as midwives and other practitioners who are providing services to women with mental health needs who are pregnant and 1 year postpartum, to provide, again, that psychiatrist direct link with a perinatal psychiatrist who has expertise in women's health and addressing the needs of pregnant and postpartum moms who might need that direct consultation. That specific initiative is going on in 4 regions of our state. It's a pilot right now. We hope to be able to expand it across the state of Texas. But it is available through the Texas Tech University Health Science Center in Lubbock, the University of Texas Dell Medical Center in Austin, the University of Texas Southwestern Medical Center in Dallas, and the Baylor College of Medicine in Houston. And so all of the counties that those specific health-related institutions cover have access to that particular program right now. We also initiated a direct message text. So if a physician wants to text us about a need they have, there's no personally identifiable information, obviously, that goes across that text message, but they can send in and say, I'm Dr. Smith, I have a child that I need a consult on, can you call me? So that enables that texting process to happen. We're also implementing something called collaborative care through the Meadows Mental Health Policy Institute that places mental health professionals within primary care practices to help integrate services between primary care and mental health care in specific clinics and institutions and hospitals across our state. We also are starting to do some direct assessments for patients who are engaged with their primary care physicians in case there's a situation where the physician is saying to us, you know, I really feel like if Johnny could just get a telehealth consult with you, that might be really helpful to me as their primary care provider. What I want to say also about the Child Psychiatry Access Network is we are not there to take over the care of that particular patient. That is the job of the primary care physician. And we are there to provide support to the primary care physician so they can continue to see that young person and provide that treatment that they need to address their mental health issues. Does anybody have questions about the Child Psychiatry Access Network? I'm just If you do, I'm open to taking them now if you have any. Okay. The next thing, yes, Judge Specia. Almost called you Dr. Specia. Yes, that's a very good question. Judge Specia asked if the psychiatrists are compensated for their time. All of the services provided through the Texas Child Mental Health Care Consortium are provided at no charge. The psychiatrists are employees of the health-related institutions across our state, so their salaries are covered already through the health-related institution where they're employed. And we really think, and we've been told, that the fact that those services are not billed, like that we don't charge for our services, has been very helpful to not only the physicians that we're working with, but also for children and families who frankly might not have access otherwise to mental health care because they're concerned if they don't have insurance or that they might not have access through their provider networks. So they're already covered. That's taken care of. That was a great question. Thank you. Yes.
There's an online question.
Oh, okay.
There's an online question. What suicide prevention training is being offered to the primary care physicians?
There is a specific program that is being provided for primary care physicians that is to help train them about what to look for in terms of signs and symptoms, and then what kinds of supports can be provided to help prevent suicide from happening. It's called, I'm trying to remember what the acronym stands for. You know what? I will look that up when I get back to my phone so I can find out what the acronym stands for, but there is a specific program that Baylor College of Medicine is actually leading that charge, and they're working with the health-related institutions across the state to be able to do that. That's a very good question. Thank you. And I will get that to you. Yes. Good morning. She was asking about the role of nurses in our work. And nurses play a key role, as many of you know, in communities in the provision of mental health services. And nurses have access to our 1-888 line to get consults. Nurse practitioners in our state, some of them actually, they are prescribing meds too, I believe. I just heard that yesterday from a mom who had called me about a nurse practitioner that was following up with her child's care. And so, yes, we definitely involve nurses in our work. They play a key role, especially in communities that might not have access to a child psychiatrist or a mental health clinician like a doctor, an MD. Yes. Yes.
Hi, can you explain a little bit more about the care coordination piece? Who does that? And
Huh?
tell me a little bit more about the referrals and
Absolutely. So the question was about the resources and referrals that we provide to through our 1-888 number when a primary care practice calls us. We actually have a program that's called WellNitty that allows our health-related institutions to enter information into that particular program of resources and communities that are in the region that they're responsible for. So a pediatrician might call and say, you know, I feel like this family that's coming to me with a child who has a mental health need, maybe they require some assistance through care coordination, case management, some other kinds of programs. Well, our staff, we have teams at the health-related institutions, not just physicians, but also social workers, psychologists, other types of mental health professionals that can look that up and provide that assistance and say, well, gosh, you know, in Amarillo, there's a child guidance center, and here is what we think they can do for you, and they link those services and supports with that physician who might need that in the community. So our Texas Child Access through Telemedicine program, you know, Jennifer talked about all those red flags that people maybe saw in school didn't do about because they thought, I don't want to, like you had said, they said something like, I just felt like I didn't know what to do, I didn't want to intervene. The Texas Child Health Access Through Telemedicine program was designed specifically for situations where a school person might identify a student that they really feel like, there's kind of a little red flag going on, or something's happening and I'm not sure what it is, but maybe the student was in 3rd grade last year, seemed to be doing all right, but now it's 4th grade and their personalities change. Maybe there's some issues going on with their behavior in the classroom. And so what happens for us through this particular program is the school gets permission from the family. Whoever has custody or legal rights to provide permission to the school to make that referral to our TCHAT program. The school's required through federal law to get that permission first. Then they would make a referral to the health-related institution within their region of Texas. That health-related institution team would then make contact with the parents to set up an appointment for an initial assessment and short-term solution-focused intervention. So we also provide education and training to school personnel about children's mental health. We have staff from our health-related institutions that, like, let's say again, they have questions about lack of a child being able to focus in class. What can I do about that? What would you suggest to me? So to be able to really provide that additional support to schools. We also have a statewide data management system that tracks referrals and how many we receive and how many children are seen and those kinds of things. On our website, you will see this map of Texas. This map tells us which schools and districts within our state are currently involved with our Texas Child Access Through Telemedicine program. Right now we have, as of August 2022, 422 school districts, 3,706 school campuses, and the covered lives that involves are about 2.4 million of our Texas students that would be covered through the Texas Child Access Through Telemedicine program through August. What I will tell you is that we have been charged by the state leadership to provide every school in the state of Texas with the opportunity to have the TCHAT program on their campus. So we are actively working right now through all of our teams across the state to do that, to reach out to those school districts, tell them what kinds of services we provide, and offer those services to them. So we've been very busy. This map also tells you which campuses are currently involved through each one of the educational service centers in our state. So if you go to our website and you look on this map, there'll be a little area to click, like if you want to click on, let's say, University of Texas Dell Medical Center, and which schools are involved with that particular health-related institution. You can click on a school district and it will also show you campuses. But if you represent Texas Education Agency and you work for an educational service center, we've also divided it by educational service center. Our folks that we work with at TEA told us that would be really helpful for the service centers to know that, because they have mental health liaisons at those educational service centers who also have been working with us to help enroll schools in our work and also to help us coordinate care for mental health services in the community. So in terms of the numbers of students that we have served during specific months of time, we've received referrals on about 13,000 students, and we have served about 7,600 students. And you will look, if you're a children's mental health professional, you know that this data is very typical for us. So you'll notice that in the summertime, referrals go down. In August, they go down. I can tell you that for the month of September, we've seen them go back up again. And that's pretty normal for children's mental health. We see that a lot. We also see sometimes decreases during the holidays where they go down and then they move back up starting at the beginning of the year. A lot of that has to do with school, and schools obviously are the ones making their referrals. So this is the statistics for us in terms of how many students we've seen over that month of time from September of 2021 to August of 2022. And then in terms of sessions that have been provided to those students that have received services, we've provided about 32,561 sessions for those referrals. And I will show you this chart. A lot of people want to know, why are children being referred to the TCHAT program? So you can see that 39%, so the highest numbers of referrals, are because of anxiety, issues around anxiety. Secondary to that is depression. And this is not unlike what we know about what we've read about in the newspaper, what we've seen on TV across the country. Post-COVID, we have seen anxiety and depression increase for children. And so this is not, anything that would be unusual. Secondary or thirdly, we have referrals for anger, students who are, their behavior, they're exhibiting, signs and symptoms of just being angry. And so those are our highest top 3 referral reasons for coming into our program or getting referred to our program. In terms of race and ethnicity, we want to make sure that we're watching, who's getting referred and that kind of thing. So the total population of race, in terms of race and ethnicity of Texas public school students, very much aligns with the referrals that we're getting into our TCHAT program. The types of services, so people always ask us, I know this is like a short-term treatment program. It was not intended to be a place where you would go in and receive long-term services. So we are there to provide the assessment and that short-term intervention. So supportive therapy is a large part of what we do, trying to really address that initial concern and then make sure that we can refer out, if they need to be referred out, to other service providers in the community. Assessment, obviously, I talked about the fact that when children come in, we want to do that assessment and find out what's going on. Cognitive behavioral therapy is a very large part of what we do as well. And case management, so information referral into community services, or just helping that family know what they might need, or ask them what they need and then refer them out for services and supports in the community. And then about 70% of the students that come into TCHAT are referred out to the community. That's probably no surprise to many of you. So a lot of those students are going to need more longer-term intervention. So individual therapists is the top reason why we would refer from our TCHAT team into the community. I also want to say that because we're providing that short-term solution-focused intervention, we do not quit our services until we know that that student has been attached or referred and has an appointment, has a way to continue care after we close the case. So we don't want to leave any family hanging between having a TCHAT service and getting what they need in the community. We also sometimes make referrals for child and adolescent psychiatrists. We also link up students who are involved in our TCHAT program with primary care physicians. So we'll ask the family, do you have a primary care physician? Are they involved with your young person, with your child, are in the provision of mental health care? And we want to make sure we make that link so that then we can continue to provide consultation to that primary care physician with the follow-up for that student through our CPAN program. So there's connections between those two programs as well. We always ask, how are we doing? We want to know from parents, what do you think of our services? Are they working? We know that over 50% of the families who respond to our surveys say that their child is doing a lot better, and then secondary doing a little bit better. So we like that those statistics are good. We also want to make sure, though, if families are not feeling like the student is getting what they need. We want to know, how can we do better? One of the things about our consortium programs is we track metrics on everything, like the length of time, for example, in our CPAN program between a call and a response, because we want to make sure that we're available. We want to make sure that we can track how we're doing. We can look at our success. We can look at areas where we're challenged and try to figure out what we can do better from a quality management perspective. The other thing we're doing through our federal funding that we received, we are able to expand our TCHAT work into other areas of Texas. We are also providing some targeted approaches to address trauma, substance abuse, suicide prevention, and anxiety. We are also doing some face-to-face and telehealth groups. And adding sessions so that for students who might need more than that short-term intervention, we are adding sessions to be able to provide that linkage between the work that TCHAT is doing and the community. We also are providing some bilingual bereavement services in certain parts of our state. And then the Youth Aware of Mental Health, we call it YAM. So I don't know if many of you have heard of YAM, and it's not sweet potatoes. I saw that look. So Youth Aware of Mental Health is a school-based program, and it's being spearheaded by the University of Texas Southwestern Medical School in Dallas. And our health-related institutions are getting trained on this approach, but what they do is they go into school campuses, meet with students, and talk with specific students beginning in 8th grade, specific classes that a school might say, hey, I'd really love to have this program here, to educate students about mental health so that they're aware of what's important for themselves in terms of their own mental health. If they have a friend who might express some concerns, they kind of know what to do about that. And it's really a way to provide that awareness of what's happening in terms of the school campus, in terms of mental health, in their own health and wellness. And that has been expanding, that particular program, to more and more schools as schools are finding out about it and campuses are finding out about it. And it is also an evidence-based program to provide services in schools. Yes.
Do you know if that's similar to the mental health first aid for teens? I believe some areas of the state might be providing.
Yes, the question was about teen mental health first aid, and we have gotten a lot of questions about that actually. The YAM project goes to 8th grade, 8th and 9th graders. The mental health first aid for teens doesn't cover those particular ages, but what we've been able to do is really work in coordination with the local mental health authorities who receive funding to provide teen mental health first aid across the state in specific schools. And if there are schools that have teen and mental health first aid and they say, oh, we don't really want to have YAM in our campus because we feel like that kind of topic is covered, we don't get involved in those campuses. But we have some schools that want us to come provide YAM who also have teen mental health first aid. And what we have found is from the places where that is happening, they're very complementary to each other. Yeah, good question. Thank you. Does anybody have any questions about the Texas Child Health Access through telemedicine before? Yes, I'll start with you.
You talked about that schools refer families to the system. Is there a process that law enforcement can refer families to the system?
That is a great question. And the question was whether law enforcement can refer students into TCHAT. I would say that if a resource officer is on a school campus, that referral may come in from a resource officer that's already on a school campus, but our referrals come directly from the schools. Yeah.
So if you're a municipal police officer, then you probably contact one of your resource officers from the schools to possibly refer them?
Yeah, the referrals have to come from the school. Yeah. And generally those referrals come through the school counselor. So if there was a situation that occurred on a campus, and let's say a resource officer was aware of that, they likely would go to their school counselor and say, Mary is having some issues that I really feel like need to be addressed, and talk to the school counselor about it. And then the counselor would get permission from the family, and then the referral would come in. Yeah, thank you.
who's first?
Yeah, the gentleman right.
I work in a local municipality that are part of a multidisciplinary team, and we help families like that get connected to services outside of the schools. But we also work with the schools as well. How does that process work? So, like, if a child presents something that the counselor's aware of or being contacted for, how does the TCHAT process get them connected to services, and like who provides that service? Not the counselor, but like, do they reach out to local clinics? Are there local clinics that are part of these teams? Like, how does that work?
So the school person would make the referral with parental consent. Our TCHAT teams are comprised of people who have MSWs, PhDs. They are MDs, like if a student needs a specific child psychiatrist to do an assessment. So those teams are embedded in that health-related institution within a community. So like let's say University of Texas Rio Grande Valley, they would be in Harlingen. And they provide the services through telehealth. And because they are local and they provide services to that particular region of the state, they are aware of the resources to refer that student to if they need other things outside of what TCHAT's providing. Does that help?
Yeah, so if, say, through telehealth, they do an assessment or whatever, and they come to find out this child may need more,
Yes.
they then reach out to a local provider of some sort, and that could be a clinic, that could be a private practice. Is it a broad range of things?
It's a broad range, depending upon that family, what resources they have or don't have, what kinds of needs are identified when that assessment happens. I will also tell you that through the Texas Education Agency, we have had lots of conversations as well with school-based programs like Communities in Schools, for example, that if a Communities in Schools person is on that campus, being able to coordinate that through them too then. Obviously, we have to get permission from parents no matter what we do, so that we make sure that they're aware and they've given us permission to make those referrals. It might be to a local mental health authority in the community. It might be to a federally qualified health center, which also provides quite a bit of services, mental health services to children and families. So it can be any of a number of different types of services and supports. Yeah. Okay, yes. Hi, Connie.
Great presentation and very impressive. I was thinking about the number of sessions and the number of lives that you've touched. Of course, I'm also thinking about our workforce shortage. So, you also talked about the connection to services. So I guess from your experience with the TCHAT project, what are some of the challenges that you
Okay.
see? Yeah, I mean, I could ask 32,000 sessions, so
Yeah.
kids get one session, do they, fall out after one session? Maybe you could talk a little bit about that.
Great question. So Connie asked the question about challenges that we're having or that we are experiencing or that we see. Absolutely, workforce. Huge challenge. Not unlike the rest of you. So recruitment and retention of children's mental health professionals is an issue for us. We have across the state, each one of our TCHAT teams, our CPAN teams, we post on our website vacancies. I think that because we provide services through telehealth, it helps us a little, but certainly it's a big issue for all of us. In fact, our consortium developed a white paper regarding workforce in Texas in conjunction with the Health and Human Services Commission, the Texas Council of Community Centers, the Hogg Foundation for Mental Health, and NAMI, because we wanted to just come together and talk about what are our needs with workforce for children's mental health, and what ideas do we have or suggestions do we have about how to address that. And what I've found that when I go around the state and talk about our work, many people have really innovative suggestions and ideas about what we can do about workforce. And so I always say after I talk, please come up to me if you have some, because I think it's going to take all of us together to work in partnership with academic institutions and training centers that can talk through with us ways that we can address that workforce shortage. And the other thing you asked about was additional challenges. I will tell you that because we provide short-term intervention, sometimes we have challenges in linkage and referral to those longer-term services. Some of those providers have wait times that are fairly long. And so again, we want to make sure that we don't leave any family without anything. And that's where also that primary care physician comes in very, very helpful. If they already have a primary care practice or a nurse practitioner, some primary care person, physician's assistant who is providing that service to them. Yeah. I'm going to go with we have, through our health-related institutions, our teams, gathering information. We have a program called WellNitty that I spoke to a little bit earlier. It's an online platform for them to use where they're filling in when they find out information about things that are available, that then they can identify and say, oh, I think I might need to link that person with this child guidance center or this food bank, or those kinds of things are listed on our online platform. So each one of our institutions has access to that for their specific area of Texas.
Ms. Evan, I have a question.
Yes.
So this is an option, correct? So schools have an option whether or not they want to involve themselves in this. Is our state legislators are looking at making it mandatory for all schools districts? Because I believe, the rise of mental health, it's not going to decrease in any way. It's going to rise, especially when children spend 8 hours of their day in a school. Is it going to be something, and I know that there are districts that have not, don't agree or don't want this program in their schools. Do you see that in the near future?
Well, right now, we've been asked to provide the opportunity for every school in Texas to have TCHAT within their campus. There are some schools that say, no, we really have enough. And some of those schools feel like they already have enough services for children on their campus. And so, we're like, okay, we won't be involved in that particular campus. It's not mandatory. They have an option about whether they want to be engaged with
And
that.
do you foresee that it could possibly be
Wow, I
something
don't know.
mandatory?
I don't know. I don't know if it would be in the future or not. That's an interesting question. So, yes, I'm going to go with the lady in the teal. Yes. Good morning. Mm-hmm. Yeah. So the question was about young people who might need more intensive services than what we are providing, right? So we make it very clear, and I think I said this a little bit earlier, our part of that continuum of services for kids is that early identification and short-term intervention. Our Child Psychiatry Access Network is to provide support to the primary care practices, including nurses, that are providing behavioral health treatment to children. If a student is exhibiting a mental health emergency, well, that is not us. We let the school campus know that they should have a protocol for what to do to respond to a mental health emergency on campus, and they should follow that protocol. That is not our work. That if a student is actively suicidal, engaging in behaviors that would harm others, that is for them to follow their protocols for emergency services. And then for young people who might be involved either coming out of a juvenile justice facility like you, the example you gave, or discharged from an inpatient facility like a psych hospital, those again are students or individual children who should, through those institutions, have been given continuity of care referrals into the community for providers who can provide that more intensive type service for what they need to transition them and reunify them back home. So. If there was a student on campus that was actively, because you were talking about Uvalde, what would we have done? That student had a weapon, and so that would not be that's a law enforcement response. It wouldn't be our TCHAP program. Okay. I see. We have a relationship with the Uvalde School District, and we are offering TCHAT services within that school through the University of Texas Health Science Center in San Antonio. So we have an established relationship with that particular school and ISD. Yeah. Okay. Absolutely. And all right, I think that we are done. So thank you very much, everyone, for your interest in our work. If you want to get a hold of me, just see me afterwards and I can let you know how to do that. So thank you.